Good evening, everyone, and welcome back to another exciting episode of It's a Match Specialty Series. Today, we're doing a deep dive into another crowd favorite, family medicine. I'm Meher, an associate at MedAngle, Pakistan, and a medical student at CMH Lahore. Joining me today is my colleague, Rabah Sia, product manager at MedAngle, Pakistan, and another medical student at CMH Lahore.
Thank you, Meher. Hello, everyone. Family medicine is a captivating specialty with a profound impact on communities. We are thrilled to welcome our speakers, Dr. Iqra Habib and Dr. Shravya Upalapati. Their diverse backgrounds promise exciting insights for us tonight. And let's start with you, Dr. Iqra. We're so excited to have you. It's absolutely fantastic. Can you start by giving us a glimpse into your background and maybe sharing one standout aspect of your journey into FM?
Yes, thank you for having me tonight. My name is Iqra Habib and I am from Sialkot, and I graduated in 2021 and I matched this year in family medicine. One interesting aspect that drew me to family medicine was this focus on primary care for the patients.
Okay.
Thank you, Dr. Iqra. Our next guest, Dr. Shravya, marks an exciting milestone as our very first international speaker in this series. Dr. Shravya, could you please introduce yourself to our audience as well and tell us maybe something unique about your journey?
Okay. Hi, guys. I'm really glad to be here. So my name is Shravya Upalapati, and you guys can call me V. So I'm from India, and I graduated in 2021. I currently matched into FM. I'm incoming FM PGY1 at Hennepin County Medical Center in Minneapolis. Interesting thing about my journey. I would like to say I do have low to average step scores, and this is my second cycle. I matched in my second cycle. So I would like to talk a little bit about it.
Okay, we are very excited to have both of you, very unique perspectives and very valuable insights coming forward for all of us to benefit from. Okay, now just some numbers off the top. We had 4,600 roundabout medical students and graduates matching into family medicine this year. Of them, 750 odd were US IMGs and 706 were foreign, so non-US IMGs. So, Dr. V, can you share some insights from this data and any other data points that you may deem pertinent, and explain, why are people picking family medicine, and are more people picking FM or fewer, and what's driving this decision dynamic?
I personally feel that there has been an increase in the number of medical students choosing family medicine. Probably because there's growing emphasis on primary care and there's a shift towards preventive medicine, and there's a greater recognition of importance of continuity of care. So I think this they might be the reasons why more and more people are choosing family medicine.
Right. Okay. And what, if I may ask, what drove your decision into family medicine?
This I actually decided when I was in my intern year. So I was working in the ER. I used to see a lot of sick people in the ER, which could have been easily prevented with regular follow-ups with primary care physicians. Like, for example, let's say diabetic foot, it could have been prevented by regular checkups and, proper education. So and that's when I decided to do primary care. And I just don't want to limit myself to one particular group of patients, and being able to treat all age groups, it exposes me to a diverse patient population, and it makes my job both intellectually and culturally enriching. And also, it's really nice to be able to treat a person for their entire life. So I'll be able to develop long-term relationship with the patient, and we will be able to provide a holistic care, like patient-centered care. And if that is what you're looking for, and I think family medicine is definitely the branch for you.
Right. Absolutely. Thank you so much, Dr. Shravya. That is so true that the emphasis on primary care is certainly growing, and the connections you make through family medicine with your patients, treating them all the way from childhood to the end, are something truly unique. Our next question is directed towards Dr. Iqra, which is with regards to basically engaging in activities in medical school that you think anybody who's watching us right now could actually do to help them build an application for family medicine.
Yes. So for family medicine, I think during the medical school, working more on outpatient care is really important in knowing what family medicine is, and then building towards that specific journey. And I think during medical school, if for everyone who's trying to match having good experiences and also working in research is really important.
Well, thank you so much, Dr. Iqra. That's definitely true. And our next question is for Dr. V, which is that what is the same things that a medical student could do after graduating medical school that could actually build their resume for family medicine? So Dr. Iqra gave us some insights into what a medical student could do, but what about after you finish medical school? What should be your next steps to build your resume and build your CV, your experiences, so that you're more competitive as an applicant for family medicine?
So apart from the scores, scores and US clinical experience are like the first things that you should focus on. But apart from the scores, I would say volunteer work in underserved communities, especially in the US. And involvement and definitely lots and lots of USE as much as you can, and especially involvement in primary care clinics. Maybe if you can do some research, if you have the resources and you have the help, maybe research on preventive medicine or community health. I think they do really help you to stand out. And for volunteering, I do have a really good recommendation. I personally worked with them. It's called the NY Reach. So it's a 3-month program. It's a combination of volunteering and clinical experience. So I think that will be, I mean, I was asked about it in a lot of interviews, like a couple of interviews, and they were really interested about it, and they were really happy that I was able to do it. So I think that's something you guys can check it out.
Absolutely. Thank you so much for sharing that. Now, Dr. Iqra, our next question is, from your professional experience, what categories should medical students that are looking to apply for family medicine in the upcoming cycle focus on in their ERAS application? Is it mostly about leadership, teaching, or are there some other essential aspects for this application?
Yes, so according to my journey, I focused mostly on primary care and outpatient care after my medical school, and it was mostly in the outpatient clinic. So according to my journey, I think you should have more US clinical experience in outpatient care if you're leaning towards family medicine. I think you should also have some leadership experiences, as I was also asked about this in multiple interviews. So I think maybe doing for that particular question, you could say about in research, and you had a leadership position in that, or maybe you started a new society in your medical school. I think that could really help your application.
Like recently, programs started to look at applications like in a holistic manner. So I think it's crucial to showcase a diverse skill set, like highlight the leadership roles, teaching experiences, clinical skills, community involvement, research, and most importantly for family medicine, commitment to patient-centered care. I think we cannot like focus on one particular aspect. It must be a holistic application.
Absolutely. The emphasis on holistic applications is definitely growing, and especially in a field like family medicine, I can see how that would be really important for your application as well. Now, Dr. Sfaria, in the same light of, developing your appearance towards applications and, and making as holistic as possible, what are some elements that you would recommend that somebody include in their personal statement when they're actually applying for family medicine as well? Something that would match up to the themes of what these programs are looking for.
Particularly for family medicine, I think your personal statement should be reflecting your experiences that highlight your passion for comprehensive patient-centered care, preventive medicine, and community engagement. and also building long-term doctor-patient relationships. So you just have to show that whatever your experience is, they align with the core values of family medicine.
Right, right. Okay. So, we can discuss, the ins and outs of family medicine and other specialties as well. But, from a professional perspective, are there one or two things in particular that they want to see? Like, is it like if you were to tell somebody, oh, this one thing, if you focus on, your program directors are more likely to, pick up on and appreciate you for. So is it leadership, teaching, something like that?
I think personally, if I was the program director, I would definitely see community outreach and volunteering. Apart from that, also the communicating, mostly volunteering. Yeah.
Right. So you would put a very big emphasis on volunteer activity, volunteer work, right? Dr. Iqra, would you agree with that?
So I did not have much experience on my CV regarding volunteering. So my interview and all the interviews I got, they were more focused on my professional experience in the US. So as I had more than a year US clinical experience, so my questions were focused on what I did in the outpatient clinics. So I think interview will focus on what you have in your volunteering experience regarding that matter. So I think it should be, as she said before, that you should have a lot of things on your CV, and it mostly depends on the program directors what they like and what they want, because some people focus on research and they would like more research on it. So I would say that keep your CV balanced so that you can reach out to more programs.
Right. Okay. Okay. All right. And so now we've had all this experience, we have volunteer work, we have, teaching, we have leadership skills. We've shown all these things. We've collected these experiences. Now we're putting things, on paper. We're writing our personal statement. How do you make sure that, your personal statement truly captures, the essence of family medicine's values and scope, and just how do you tailor your personal statement for this? Dr. V?
So personally, like what I wrote in my personal statement was how I grew up, and the type of community I grew up in, like what were the healthcare disparities in my community, and which was one of the reason why I went into medicine. So if you really like in my community, there were a lot of healthcare gaps. So I think if you are from a community like that, you can just start with that and tell them why you are interested. I mean, it's going to be different because personal statement is going to be different for each and every person, right? So I'm just going to say how I wrote mine. And I also wrote why I was interested in family medicine, what exactly drove me into family medicine. Like I mentioned before, how like primary care or just preventive medicine could have prevented a lot of things like progression of diseases and all. So I wrote about that, and I wrote a couple of my experiences regarding community outreach and volunteering. So it just put all of your experiences together and just explain how those experiences helped you, how it aligned with your goals, like how it really made you wanted to pursue family medicine.
Right, right. Okay, okay, okay. All right. So now, when it comes to the actual match process, right? How does, I mean, this is entirely your experience. This is anecdotal. How does the family medicine match process differ from other specialties? I am, neurology. How does family medicine differ?
Personally, I think there are not a lot of differences when it comes to match process, but I feel that family medicine, a lot of family medicine programs, they focus on a holistic application instead of one specific criteria. Like program values applicants who demonstrate commitment to primary care, community health, and patient-centered care most of the time rather than like focusing on scores. I think it's more of a holistic approach.
Okay, okay, all right. And Dr. Iqra, how, did you find that the family medicine match process differed in some way, like to what you were expecting, maybe?
Now, I completely agree with Dr. V on that. For family medicine, it's more holistic approach, and they see everything on your CV and just don't focus on your step scores. That's why if you get low to average scores in family medicine, you still have a chance in matching.
Right. Okay. And Dr. Iqra, we're all IMGs. Do you have any specific insights or pointers into identifying family medicine programs that are IMG friendly, whether you are a US IMG or a non-US IMG?
Yes. So for that reason, I think we should start using Residency Explorer early on, since on that we have a lot of programs, and then you can use some filters and choose US IMG and US non-IMG friendly programs. And from that you can look up the program, go to the websites, and then you can see if your credentials will match with that program, and then you can apply. In that way, you can apply to more programs in which you will have a chance of matching, because some programs are not friendly to IMGs and some programs are not friendly to the specific race you are with. So I think that also helps if you search the programs thoroughly and see what the residents are like there, and if you can identify with them.
Right. Yeah, no, that's very valid. That's very true. So, when it comes to finding the right residency program, what was your approach? How did you go about it?
I can take this. So I think you can start by evaluating the interview experience and assessing how the program aligns with your personal values and career goals. So, and apart from that, you can do a thorough research. If possible, visit the program and talk to the current residents, gather some insights. I think they can all help you in the decision-making process. But finally, just prioritize a program that aligns with your career goals and offers a supportive learning environment. For me, Hennepin, when I interviewed at Hennepin, I really loved the interview experience, and I was able to connect with everyone, like the residents and the program director. We had a really nice it was not like an interview, it was just like a formal meeting, normal meeting. So yeah, and Hennepin was my top choice. There was an instant connection with the program. So I think you need to consider all of this. And apart from that, you can also consider like location, your family, and if you have any family in the area, like if you want to stay close with them. And so they all will help you in the decision-making process.
Right, right. Any red flags you want to introduce to our audience about programs that, may not work for people? Anything there?
Sure. So some you can tell that there are red flags which when there's like high turnover rates among the faculty or residents, and there is limited opportunities for hands-on experience, and or when you get like a mixed reviews from the residents, and inadequate support for residents, or a program culture that doesn't align with your goals. So you can spot the red flags.
Right, right. And, recently we've had regulation changes that have allowed for signals to be a more important thing, more important aspect of the match process. Can you comment on those a little bit?
Yeah, like I think there are around 5 signals for family medicine. So I think signaling is a great way to tell a program that you're interested. And I also heard that programs actually go through the signaling list first, and then move on to the other candidates. So it's a great way to tell a program that you're interested. And especially if you have family in the area and you want to stay in that particular area, that's signaling really helps in that way too.
Right, right, right. And so, Dr. Iqra, how did you use signals in your application process?
So yeah, I think signaling is really important with the programs, as a lot of applicants are applying to different programs, and that helps the programs filter out the application. And if, as an applicant, you are choosing to signal a program, I think you should see if you are compatible with that program. Try searching about that program, since you only have limited options, and see if you are close in that area, because you will need family support during residency. And I heard back from few of the programs I signaled. So I think signaling is really becoming more important, as it was just introduced last year. So I think it will be more important in the future matches.
Right, right. Okay, okay. So signaling is something you've both used in your application process, right? And you've used it to, well, signal program that you're really interested in them. And if I'm not mistaken, there are 5 signals in F.
Yeah.
Are there any regulation changes expected moving forward? Do we expect this
Um,
to increase?
I I mean, I think they already released the data for next year, like how many programs you can signal. It's still 5, but they might increase because the number of applications are increasing. There is a chance that they might increase the number of signals. Like for internal medicine, they did from I think 7 to 10. So yeah, there is a chance for family medicine as well in the future.
Right. Okay. Okay. Right. So the point of signaling and the point of all these little markers is effectively to draw attention to your application, right? One of the best ways to draw attention to your application has to be knowing the people in the program, right? Networking. How
Definitely,
important
yeah.
a role would you say networking plays in the entire match process? And how were you able to really effectively network? What strategies, what sorts of things did you try?
I think networking is one of the most underrated thing when it comes to applying for the match. So networking really plays a very important role. I personally got around 3 interviews through networking. So yeah, so if I know it's just gonna be a little hard in the start, but just build connections with your colleagues, mentors, and other professionals in the field. Attend conferences, workshops, seminars related to family medicine, and actively participate in professional organizations. There's American Academy of Family Physicians, and we can also engage in communities and forums. Apart from that, utilize social media like LinkedIn to connect with family medicine practitioners, residents, and directors. You just have to look, there's a lot to do. There's so many things. Like we have Instagram, we have LinkedIn, thanks to internet. So yeah, you can just reach out to doctors, but you have to stay in touch with them. Like it's not like just talk to them one day and maybe like a year later you just want to talk to them and you just ask them to recommend you to a program. That's not going to work, obviously. Just stay in touch with them and just keep updating them regarding your CV or your scores and whatever you're going through. And I think that networking is again, networking is really underrated.
Absolutely. Thank you so much, Dr. V. I do want to ask you, are there any precautions you would recommend to anybody that's looking to reach out and network with physicians that they've never interacted with before? Is there a specific way that somebody should approach that interaction? Anything they should avoid saying? Anything that would help their case in building a strong connection that could actually help them reach interviews as well?
I would say just keep it simple. Talk, just mail. You can mail them or message them on LinkedIn, and just keep the message short. And just tell them that you're a student. You'll be applying to so and so specialty, and you're interested in family medicine, and you just want to know more about the specialty, and you would like some help if they are really interested and if they have the time. And a lot of people do. Like I reached out to a lot of people, and not everyone does, but a lot of people do help.
Absolutely. Thank you so much for clarifying that. I'm sure that'll be very helpful for any viewers we have right now that are looking to start reaching out to physicians for this upcoming cycle. Now, at this stage, we've discussed looking for programs, we've discussed signaling, we've even discussed interviews and red flags in different programs. Now, let's talk a little bit about the post-match, right? Let's say you match into family medicine, of course, Dr. Iqra and Dr. V, you guys have both matched and you're successfully incoming PGY1s. Could you describe the difference between actual residency versus the attending lifestyle in family medicine?
Sure. So I think the residency is the hardest part. Like at least the first year is, and you'll be working in a lot of different specialities, a lot of different areas. So you'll not have a consistent life. Like one day you'll be working from 9 to 5, and the other week you'll be doing night shifts or more, like working 12 hours a day. So, but when it comes to being an attending, there is a lot of work-life balance. So especially if you're a primary care physician, and it's mostly 9 to 5, or it depends, on the clinical hours. There is a lot of work-life balance in family medicine, and there are a lot of opportunities as well. Like after residency, we have a lot of career paths. Like we have sports medicine, we have geriatrics. You can also go into internal emergency medicine, and yeah, hospitalists, and these are like on top of my head. So I think after becoming an attending, you'll have a lot of time. You'll have a lot of time to do all the other activities as well.
Absolutely. Thank you so much for explaining that. If I'm not mistaken, I think that, and correct me if I'm wrong, I think pain management and sleep medicine is also some other opportunities you can explore. Yeah, fantastic. Is there some other opportunities you can explore after you complete family medicine residency? Now, how would you describe the rigor and the intensity of residency in family medicine compared to other specialties?
Honestly, I'm not very sure, but I heard it's a little better compared to the other specialities. But I mean, I just have to experience it before I tell something. Yeah.
Absolutely. Dr. Iqra, do you have anything to add?
Yeah, I agree with Dr. Strabel because we're not familiar with residency, but I have also heard that it's going to be easier.
Great, thank you so much. Now, our next question is with regards to the role that a family physician can play. Now, throughout this session, we've discussed a lot about primary care and preventive care as well, and the very pivotal role that a family medicine physician can play in treating these patients and tackling these kind of morbid conditions from a very early stage. Now, Dr. V, could you tell me a little bit about what you think the role is that a FM physician can play in actually advocating for healthcare policy changes and actually improving patient care at a more systemic level?
As primary care physicians, I think we can identify gaps in healthcare delivery. We can advocate for policies that prioritize preventive care, address social determinants of health, and we can also improve access to affordable healthcare services. So since it's a holistic approach, it allows us to advocate for patient-centered policies, ultimately leading to better health outcomes and more equitable healthcare systems.
Absolutely. Thank you, Dr. V. Dr. Iqra, do you have anything to add on?
Yes, for that particular, I completely agree with Dr. V that as family physician, we should focus on improving primary care. But I think we should all, going forward, we should also, the physician should also focus on the insurance policies, as sometimes we cannot treat patients who do not have insurance, or maybe the insurance expires and stuff like that, and that really is something that needs to be changed in the future.
Absolutely. Yeah. Insurance is a very specific and very concerning aspect in the United States healthcare system as well. Are there any specific instances or anything that, really raised this as a concern for you, like the insurance with patients? You did mention that you have had a lot of US clinical experience as well. Did you maybe encounter insurance issues with patients as you were working?
Yeah. So yeah, I worked in a outpatient clinic, and that happened a lot. As a lot of times, the patient insurance suddenly did not work, and they would get billed, and they could not afford it. So I think that's really important for the system that it needs to change. And sometimes we also had some uninsured patients and who could not afford treatment. We tried to help them out as much as we could, but sometimes it was still not enough. So after those instances, I think that we should focus on that going forward.
Absolutely. Thank you so much for providing that insight. And I absolutely agree. As a family medicine physician, you are the primary point of contact for that patient. And, insurance policies are something that can cause a lot of hindrance towards the actual treatment process. So it's definitely something that should be a focus as well. Now my next question is for Dr. V, which is what career paths within family medicine do you specifically find most intriguing and why?
I think one exciting career path is sports medicine for me. It's really exciting to be working with athletes, and since I'm an active person, I like to work out, and I love to go outdoors and play outdoor sports. So it's just nice to integrate both my hobby and my profession. It's where they intertwine. And it's also a field that inspires personal commitment, like to stay active and healthy. So yeah, I do want to explore other fellowship options as well. But for now, I think sports medicine is really exciting.
Absolutely, that sounds amazing. Thank you for sharing that with us. Dr. Iqra, how about you? Do you have a specific subspecialty you're looking into going into within family medicine, or would you like to have family medicine as your primary?
So right now, I do want to work in primary care, but I'm also interested in preventive medicine as it's a very important aspect in family medicine. So that's something I would like to do in the future.
Absolutely. Thank you so much. Now, all right, Dr. V, this next question is for you. And it is, which trends or developments do you foresee shaping the future of family medicine? Now with the addition of AI, as well as different levels within the American medical system, where we have nurse practitioners, physician assistants, et cetera, that are also part of the system and actively playing a very big role within primary care as well. Where do you think the future of family medicine is going? Do you think there's going to be a greater need for family medicine physicians, or do you think that we're heading towards a bit of a negative incline?
Sure. So definitely, I heard that US has a need of primary care physicians. It requires a lot of primary care physicians rather than the inpatient doctors or emergency physicians. There is a lot of need for primary care physicians, especially in the underserved areas. And I think the future of family medicine will definitely be it will be influenced by telehealth. It's a like in a positive way. And there's also integrative medicine, and there's a lot of technological advancements like the electronic health records, and there are new devices that are being invented. So all of these, it's going to be a positive impact on family medicine, I think. And there is definitely a lot need for primary care physicians in the US. And coming to like subspecialties, there are so many areas. There's growth in so many areas like geriatrics, sports medicine, pain management, and yeah, there is like preventive medicine. So all this will offer a very diverse career opportunities for family medicine physicians.
Okay, so with that, I think we can come to a close. On behalf of the entirety of MedAngle and the audience, we thank you, Dr. Sravia and Dr. Iqra, for your time, your effort, and your energy. This has been an especially productive session, and I'm confident that our very resourceful and talented audience will derive just tremendous value from it. As always, MedAngle is committed to revolutionizing medical education in Pakistan and beyond. And for more resources, guidance, tools, please do visit our website, medangle.com. Have an amazing night, everyone. Thank you so much once again, and good night and goodbye. Assalamu alaikum.